A 25-year-old man presents with an ulcer on his penis. He says that he noticed the ulcer a week ago while taking a shower and it has not improved. He denies any pain, penile discharge, rash, dysuria, fever, or pain on urination. His past medical history is not significant. Sexual history reveals that he had 6 male partners over the past year and he uses condoms infrequently. On physical exam, there's a 1 centimeter ulcer on the dorsal aspect of the penile shaft. The edge and base of the ulcer are indurated, but there is no bleeding, no discharge. 2 enlarged, non-tender inguinal lymph nodes are palpable on the right. There is no evidence of a scrotal mass or urethral discharge. HIV is negative. Which microorganism is most likely to be responsible for the patient's condition? So is it Haemophilus ducreyi, Klebsiella inguinale, HSV, Treponema, or chlamydia? So if you just pick up on the features of the ulcer, very simple question. So first of all, he's denying any pain. So that would be essential to pick up on. It helps us rule out some of our differentials. And then the induration is another thing, and the painless lymphadenopathy. So I think pretty simple. We've done this in our previous classes as well. I'm just going to... So all you needed to be able to identify that this is a painless lesion, and it's got induration, 1 centimeter ulcer on the dorsal aspect of the penile shaft, and it's indurated, no bleeding, no drainage, and the painless lymphadenopathy, and you're good to go with this question as well. Okay, so the different microorganisms that can cause genital lesions can be differentiated on the patient history and findings. Treponema pallidum is a causative agent of syphilis. Primary stage is characterized by the painless lesion on the genitals known as the chancre, which heals without any treatment. And the definitive diagnosis is by dark field microscopy of scrapings taken from the chancre, demonstrating a spiral-shaped gram-negative organism. So you know this, it's a spirochete, very thin, lacks a cell wall. It cannot be visualized on routine gram staining, and that's why we need to do dark field microscopy. And definitive diagnosis is by serology. So let's just quickly go over this table again. I know we've gone over it many times, but it is a very important table. Okay, so HSV is caused by HSV 1 and 2. The primary lesion is a vesicle, multiple and in clusters. It will have an erythematous non-purulent base. It is very painful, and you will see tender bilateral lymphadenopathy. On histology, it's the multinucleated giant cells with intranuclear inclusion bodies, or the Cauchy type A antibodies. Okay, so vesicles and painful in clusters. Syphilis, you will see a papule which will progress to an ulcer. It will be a single lesion, not multiple like herpes. Indurated base, which we saw in our question, not painful, non-tender bilateral lymphadenopathy, and again the thin corkscrew-shaped organisms on dark field microscopy. Chancroid, we all know, is painful. It will present with a papule or pustule, multiple lesions, ragged borders. It will be purulent. You will have a grayish base with this, painful, tender, unilateral with suppuration or the buboes, and school of fish appearance on microscopy. These are all keywords, all very high yield. You need to know this table. Granuloma inguinale is caused by Klebsiella inguinale. You will see nodules, a single lesion, not painful, lymphadenopathy. You will have no lymphadenopathy here, and deeply staining gram-negative intracytoplasmic cysts are seen. And the last organism here is LGV, which will also present with a single lesion, which is non-painful. However, the lymphadenopathy will be tender, and you will see the chlamydial inclusion bodies. So just remember the two tender ones, and then everything else is non-tender. Herpes and chancroid are painful. Everything else is non-painful, and then the other characteristic findings. And you should be fine with these questions.
Thanks for watching. Please give a thumbs up and subscribe for more.